United Health Group is bringing in-home treatment directly to patients, closing care gaps, identifying risks earlier, and improving patient outcomes. In 2025, patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
Bring on the off-road. Bring home a new Honda. With a great deal on your favorite Honda vehicles. Conquer trails and back roads in cars built for exploring. With the rugged Honda Pilot, Ridgeline, CR-V, and Passport, the road might stop, but you're not done. All from the 2025 Kelley Blue Book Best Value brand.
Based on 2025 Consumer Choice Awards from Kelley Blue Book, visit kbb.com for more information.
Food is at the center of so many cultures. Sunday dinners bring families together, brunch has become a great way to catch up with friends, and happy hour is the top choice for building camaraderie in the workplace. With so much of our social life revolving around food, can you imagine what it would be like to dread each and every meal? That's exactly what it feels like for people with an eating disorder called avoidant-restrictive food intake disorder, or ARFID. People with ARFID may limit the amount of food they consume, refuse to eat certain nutrients, or even cut out entire food groups. The disorder is often misunderstood, but Dr. Kamryn Eddy explains that it's much more extreme than simply not liking food.
It's not just picky eating. It's sort of much broader than that. So it's people who are limiting the volume or variety of foods that they're eating in a way that really interferes with their overall well-being, so their physical or mental health.
Eddy is a professor of psychology at Harvard Medical School and co-director of the Eating Disorders Clinical and Research Program at Massachusetts General Hospital. She says that while many other eating disorders stem from body weight and composition issues, ARFID is different.
More often, the rationale for food avoidance or restriction is kind of one of three presentations. It's either because folks may have really like a sensory sensitivity, so that different foods like tastes really strong or intense or gross or kind of disgust them. It may be because they've had a really negative experience with eating, like a food trauma where they've had a choking experience or vomiting, and then they become really scared about having that same experience again and then restrict their intake. Or it could be people who just kind of don't find food to be that rewarding, people who don't get hungry and they maybe don't enjoy eating and find it to be kind of a chore.
Cassidy Arvidson is one person that falls into this group. The idea of wanting to eat is a completely foreign concept to her.
I have a hard time imagining what it's like to have an appetite. I really don't understand how people have cravings or are excited to eat something. Like, to me, that is so foreign. I'm like, what? Because eating is such a chore for me because I have such a low appetite. I do not care about eating. I'm never like, oh my God, I'm so excited about this.
And though our society tends to glorify weight loss diets and extreme workout plans, Arvidson says having an appetite is a privilege she dreams of one day having. Though we don't yet have all of the research needed to fully understand this condition, Eddy believes that there's some sort of biological predisposition for developing ARFID. It could be as simple as having a naturally low appetite, or a higher sensitivity towards textures and tastes. The condition can also be triggered by a traumatic experience with food or a negative situation during a meal.
Taken together, this leads to them having sort of a host of negative feelings and predictions about the consequences of eating. And that can look really different for different people. So it could look like eating will always be unpleasant. I'm not going to enjoy it anyway. It could be, I'm going to have a really scary experience, like I'm going to choke on something. It's going to taste awful. It could be folks who are kind of feeling like all new foods are going to taste disgusting. They're all different. I don't never know if I'm going to like it anyway. And then in turn, that leads to significant food avoidance and restriction,
which can easily lead to nutrition deficiencies, low weight, and sometimes feeding tube dependency. Aside from the health aspects of ARFID, Arvidson says the condition can be extremely isolating.
Dating is really, really difficult. It's so social. Everyone wants to go out for a dinner or drinks, birthday parties, work events, and everyone has an opinion on how you eat, what you eat, how much you eat, how little you eat.
In general, people with ARFID love consistency. They want to know what to expect in every bite, from color and texture to temperature and taste.
I don't eat anything cold. Room temperature or warm is the only foods that I eat. Color-wise, this is really common overall with ARFID in general, but I do relate to this as well, is a lot of my food that I eat are beige colored or tannish/yellowish. So bread, chips, pasta, all that kind of, they're very similar in like color.
She also prefers to snack on chips, popcorn, or crackers throughout the day rather than have big meals. Making sure that the texture is consistent is another major factor. Arvidson says that many people with ARFID struggle to eat meats, fruits, and vegetables since each piece can differ drastically from the next.
I do not eat any fruit. I couldn't even tell you what the experience of eating fruit is like because I've never had it. I just I'm so scared of it. When you get a container of berries, none of them are the same. None of them are the same shape. Some of them have like bigger or smaller. And I think the size also influences the taste sometimes. They can be squishy, they can be more hard. And so those are just inconsistencies. And people with ARFID, like I said previously, really love consistency with their food. So if you think of like a potato chip, most potato chips, regardless of size, are the same flavor, same consistency. And if there is a quote unquote deformity within like the potato chip, like say there's like a burnt piece, you can literally just like take it off and it doesn't affect the other pieces.
Despite the fear that Arvidson feels, many people are comfortable openly teasing or mocking her condition. What they often don't understand is that for many people with ARFID, eating anything outside of their safe foods is one of the scariest things they could do.
Imagine that you are being faced with whatever your biggest fear is daily. That's kind of what it's like for someone with ARFID.
The condition was only officially recognized as a diagnosis in 2013, but Eddy says it's been around for much longer.
So in the DSM-5, it's really like a reformulation of what used to be called feeding disorder of infancy and early childhood, meaning that it used to be a presentation that people thought, had to begin before age 6. And we didn't really talk about it beyond age 6. But the truth is, people with ARFID don't outgrow their picky eating after age 6. And in fact, it often kind of becomes more entrenched over time. And so it's a new diagnosis in that it's a new naming of this presentation, but really it's recognition of something that's been around for quite a long time.
Arvidson was diagnosed a few years ago during her stay at an inpatient treatment center and has since gained thousands of followers on social media by talking about her ARFID experience. While she's not so optimistic about her chances of total recovery, Arvidson says the best treatment she's had so far has been hypnotherapy.
I see the most benefit for avoidant and restrictive, the two subtypes I have, because you are directly speaking to the subconscious mind, is where obviously all my beliefs around food are located.
And though Arvidson is skeptical about healing, Eddy says she's seen a lot of success with her ARFID patients that range from making big life changes to reaching full recovery. Her and a colleague have developed a recovery plan for ARFID that Eddy describes as action-oriented treatment. It's designed as a 20-week outpatient program that includes cognitive behavioral therapy, ARFID and nutritional education, and exposures.
And exposure really means getting practice with things that they've been avoiding to help them get, build skills and build mastery, and then decide themselves kind of which foods they're ready to move from tasting to incorporating and then broadening their diet. And the goals of treatment are really to help them no longer meet criteria for ARFID. So helping them to overcome their anxiety and discomfort around eating, helping them to eat more regularly so that it also helps to build regular appetite, and that they're eating foods now from all of the 5 food groups so that it reduces their nutrition deficiencies, and then really targeting the foods that are going to help them get back in their lives.
The exposures aim to help patients challenge the negative feelings and predictions about eating. For example, Arvidson believes her low appetite can't be changed because it's how her body naturally functions. However, Eddy would challenge that belief.
If her biology is sort of giving her not enough clues that it's time to eat, if her dinner bell is not alarming for her that it's time for her to eat, we want to override that system by helping her to just do it in a pattern by kind of just literally following the clock. And that over time, that's something that her biology might catch up to as well. It might actually help her to start getting those cues.
Eddy says that these types of exposures can help push individuals and help them realize that they have more control over their body than they may have thought. Unfortunately, she's noticed that these challenges are often lacking in many of her patients' lives.
They have stopped eating with their families. They've stopped being invited out to dinner. And often, when they come to us as young adults, they don't have any exposure to eat certain foods. To give you just a simple example, we've had some patients who have come to us unable or not practiced with eating any kind of fruit. And often, they're not even sure where to begin. So do they peel the orange? Do they bite in? Do they peel the banana? How do they even do it? And I know that's a more extreme example, but it's an example of when you don't have any modeling or exposure to how to do these things, it can become even weirder and even more challenging.
So she encourages patients and family members to continue exposing people with ARFID to a variety of food. Even if they don't eat it, the experience will help get them more comfortable and knowledgeable about their fear foods. Eddy says it's also important to realize that the goal isn't to like every food.
Not everybody needs to be able to eat broccoli. You need to be able to get those nutrients. But if you are not interested in doing it with broccoli, there are probably many, many, many other ways to be able to do it. And you could be a totally healthy, functioning person who doesn't eat broccoli.
You can find more information about Dr. Kamryn, Eddy, Cassidy, Arvidson, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. This segment originally aired in August 2024. Our executive producer is Amira Zaveri. I'm Kristen Farrah.
Truckers aren't just moving goods, they're making sure bakers get their chocolate chips and hotels get their tiny soaps. But truckers can't do this if they're not on the road. That's why Progressive has over 360 heavy truck employees to help truckers stay on time and on track. Quote truck insurance today in as little as 8 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates.
Bring on the off-road. Bring home a new Honda. With a great deal on your favorite Honda vehicles. Conquer trails and back roads in cars built for exploring. With the rugged Honda Pilot, Ridgeline, CR-V, and Passport, the road might stop, but you're not done. All from the 2025 Kelley Blue Book Best Value brand.
Based on 2025 Consumer Choice Awards from Kelley Blue Book, visit kbb.com for more information.